Okay, Naveen, we'll discuss about the bleeding time and clotting time
Yes, ma'am.
the next few minutes. Right. Define the bleeding time.
So it is the time between the finger prick and the arrest of bleeding, ma'am.
Okay. Which blood cell is tested by this
Mm,
bleeding time assessment? Why?
Platelets. Uh, platelets is the one which is responsible for the blood clot, ma'am. So thereby it stops bleeding, stops the
So
bleeds.
this is the one, platelets are the one which forms the primary
Primary
hemostatic
hemostatic.
blood.
Yes, ma'am.
That word is important.
Yes, ma'am.
Okay, fine. What is the name of this method?
Duke's method, ma'am.
Do you know any other method?
IV method.
Okay, good. What is the normal bleeding time by this Duke's method?
Mm, it's 1 to 5 minutes, ma'am.
Okay. Can you tell me the procedure of this method?
Yes, ma'am. So after a sterile prick injury, the punctured site is touched with the filter paper for every 15 seconds. So the spot on the filter paper with no bleeding is marked as the point of arrest of bleeding, ma'am.
Okay. So you will be counting until then
Yes,
all
ma'am.
the spots. In some books it is given as 15 seconds, and
Mm.
some medical colleges they used to teach us 30
30 seconds,
seconds
yes, ma'am.
also. But generally 15 seconds is preferred. Why? Because the bleeding time is very narrow,
Mm.
1 to 5 minutes. So you can exactly mark where the bleeding stopped
Yes,
if
ma'am.
it is touched every 15 seconds.
Yes, ma'am.
Right? Okay. Can you tell some conditions where the bleeding time is prolonged more than 5 minutes?
Mm. Thrombocytopenia,
Okay.
thrombasthenia, and aplastic anemia, and viral infections like dengue hemorrhagic fever and chikungunya, ma'am.
Okay. What is thrombocytopenia?
Decreased in number of platelet, ma'am.
Which condition thrombocytopenia is seen?
Mm.
What is ITP?
Idiopathic thrombocytopenia
Thrombocytopenic
purpura,
purpura.
ma'am.
What do you mean by purpura?
That rashes will be there, ma'am.
Ah, yes. The reddish or purplish
Reddish.
spots seen underneath the skin is
Yes,
called
ma'am.
as purpura.
Purpura.
It is actually the manifestation of decrease in
Yes, ma'am.
platelets. You can see even in dengue hemorrhagic fever, you can see that is one of the tests.
Okay.
If more than 20 spots are there, then it is significant.
Okay, ma'am.
Okay, fine. So dengue hemorrhagic fever you told,
Yes, ma'am.
viral any viral fever, the platelets will be decreased.
Yes, ma'am.
Okay, fine. What are the other tests apart from this bleeding time? What are the other tests that can be used to assess the bleeding disorders?
Clot retraction, uh, PT, that is prothrombin, and APTT, that is activated partial thromboplastin time.
Okay. What is clot retraction?
So it determines the work of the platelet, ma'am.
Okay.
So basically, at 1 hour, the 50% of the clot is shrunk.
Okay.
In after 24 hours or 48 hours, the entire clot will
Clots
be
will be
shrunk, ma'am.
shrunken within 24 hours.
Within
That is the
24 hours.
maximum time.
Yes,
It
ma'am.
starts within 30 seconds. Clot retraction, that is
Okay.
shrinking of the volume of the blood clot, starts by 30 seconds. By 1 hour, 50% of
Okay.
the clot will be shrunken.
Yes, ma'am.
Yes. So other two tests like partial thromboplastin time, APTT,
APTT.
all those things you should know it better when you go to second year. For first
Sure.
years, it's enough if you name it,
Yes.
right? Okay. So we'll move on to the clotting time.
Yes, ma'am.
Okay. So define clotting time.
So it is the time between the finger prick and the formation of a definite fibrin thread in the capillary tube, ma'am.
Okay. What is the name of this method?
Wright's capillary tube method, ma'am.
Okay. Any other method you know
Uh,
of?
Lee's White method.
Lee-White method.
Lee White method. Yes, ma'am.
Okay. Fine. What is the procedure adopted in Wright's capillary tube method?
After a sterile prick injury, the blood is drawn into the slender capillary uh, for 2 minutes. Okay, and we should keep undisturbed for 2 minutes, ma'am. And after 2 minutes, we have to break a small piece and we have to check whether any fibrin thread is formed or not. So if not, after 30 seconds, we have to break another piece and so on until and unless we get a definite fibrin thread, ma'am.
Okay. So make sure that the final fibrin thread is actually holding the broken piece
Okay.
and along with the main capillary tube. You should show the examiner like as if it is hanging with the help of the fibrin
So
thread.
what about the
Okay,
broken pieces,
you
ma'am?
should not discard it. You
Okay.
should be keeping the number of pieces. So that is actually a proof of your result.
Yes, ma'am.
If it is, say for example, 3 minutes is your clotting time, how many pieces you should have?
6.
Why 6? At the end of 2 minutes only you're going to break the first
Okay.
piece.
Okay.
Okay, at the end of
So it
2
will be
minutes,
2.
2.5 minutes, 3 minutes.
Okay.
So the third piece should be attached to the main
Oh.
capillary tube. Apart from the 2 other pieces you should be having.
Okay,
So
ma'am.
never discard the broken pieces of capillary tube.
Yes, ma'am.
Right? Okay. Now what is the normal clotting time by this method, capillary tube method?
It's 2 to 8 minutes, ma'am.
Okay. Can you tell me some conditions where the clotting time is prolonged?
Clotting factor deficiency, like hemophilia, and chronic liver disease, in which decrease in the clotting factor synthesis. Chronic renal disease, in which there will be more of excretion of the clotting factor, and also in vitamin K deficiency, ma'am.
Very good. Okay. So which are the clotting factors that are deficient or that are not produced in vitamin K deficiency?
2, 7, 9, and 10, ma'am.
Very good. So remember it as a mnemonic 2, 7, 9,
9,
10
yes,
vitamin
ma'am.
K dependent clotting factors. Okay. So one last question
Yes,
for
ma'am.
clotting time, maybe a star question. Okay. So this Wright's capillary tube method,
Yes, ma'am.
clotting occurs by which pathway, whether it is intrinsic or extrinsic pathway?
Intrinsic pathway, ma'am.
Why do you say so?
So the capillary tube is basically negative charge, ma'am. So negative charge can activate the intrinsic pathway, ma'am.
Negative charge, and it's also a wettable surface.
Okay.
So whenever the blood is exposed to the negative charge or wettable surface, the intrinsic pathway will be
Activated.
Very good, Navin. So once again you have proved that you are a star student.
Yes, ma'am.
Okay, do well in your exams.